Welcome to this session on budgerigar endemic diseases. We're basically going to be covering what sort of diseases we find present in budgies, pretty much as standard, to be honest, and sort of give you a little summary and go through of these diseases and how we deal with them. So there are currently 8 endemic diseases in budgies. This means that everybody has them or hasn't been exposed to them, etc., etc. If you're into exhibiting your birds, then you're mixing them together. You're going to be picking up these diseases from that show hall, perhaps, mixing birds in the back of the car, for example. And out of these range of diseases we've got, some of these we can effectively eliminate. And obviously for the more responsible breeders, then if we can eliminate these diseases, so much the good. And others, then we're looking at management changes to minimise their impact in terms of disease, in terms of presenting clinical disease, and the morbidity and mortality of those. So reintroducing these diseases into your birds after having eliminated them, or reintroducing a novel variant, is something that is of concern, and that's something we all should be looking at when we're dealing with trying to minimise the impact of disease in the birds. So, first disease we're going to go through is scaly face. So, scaly face basically is Nematococcus pilae. It's a mite. First described in 1951, so it's a well-recognised disease. And these mites spend their entire 3-week life cycle on the birds. And they basically feed on the keratin, so that's the protein of the feathers, beak, nail, things like that. These end up producing tunnels through these, which makes cavities, and you get little pouches forming, and what you end up really with is a honeycombed appearance or lesion of that keratin. And this sort of is a classical sort of sign that we'll be seeing on the cere and beak of budgerigars. Birds can carry the mite, not have lesions, and progression can take months to develop through to clinical signs. And in order to get transmission from bird to bird, you do need prolonged close or direct contact. Face rubbing on perches is possible, but it's an uncommon route. This is a bird-to-bird thing, really. And this is the classical sort of example that we would see here when we've got this honeycomb appearance. This looks like a duck, quacks like a duck. We probably have a duck here. In most cases, you would be treating for scaly face based on clinical presentation. One of the concerns we have with the scaly face, I guess, is if you are getting progression onto foot lesions as well as we have here on this budgerigar. The point to note here is that we are getting ring binding here where the whole leg and tissue is swelling up, and this actually is now at risk of causing damage due to that ring. This ring needs to be removed as an emergency to save this bird's leg. So basically, if you see scaly face, it's probably scaly face, and that's it. Yes, you can skin scrape. This is a little Nematococcus mite on the slide here. Very characteristic sort of appearance if you wanted to confirm the diagnosis, but in most cases it's based on its clinical appearance. Second mite disease we're concerned about is the red mites. These are of greater concern. These are motile mites, blood-sucking mites that will spend their time off the bird as well as on the bird. It's Domanosus gallinae here, and all birds will carry this mite. So wild birds, for example, if you've got house martins, for example, under the eaves of your house, wild starlings, passerines, chickens, whatever you've got, all of these individuals could carry these mites and transmit them to the birds, so they're not species specific. But given there's been a shift now and budgies being mostly housed inside, the risk for them in getting these from wildlife is markedly reduced. So your most likely source of infection here is going to be another budgie that you bought in, shared transport, going to a show, or, given the hobby is contracting a bit, going out and buying somebody's nest boxes or cages and going, oh, I'll use them, they're cheap and second hand. If you've got red mite in the environment of those boxes, then obviously you've just reinfected your stud as well. So dry stock is a risk factor for your red mite. And like I say, this is a blood-sucking motile parasite, got a lovely little reproductive cycle here for it. And literally, when you look through this cycle here, obviously it can cycle very, very quickly over that time period. And you've got blood-sucking stages that will come on and off the host, the proto-nymph, deutonymph and adult, but obviously the eggs and larvae will sit in the environment. And if you're looking at nest boxes, this is just sort of a classical sort of nest box here where you're pulling the drawer out and you're looking in the nooks and crannies, and you basically have got active mites running through here that you're finding hiding in the environment off the bird. And this is a serious disease. You do not want this disease in your birds, and if you eliminate it, you certainly don't want it back. It's very irritating to the birds. We get severe anemia, nestlings in the nest, babies, you'll get a significant mortality associated with that. And obviously you need to sort this out with products that actually work and methods that are proven. And because it's such a big thing, in poultry, for example, where they are exposed to wildlife reservoirs on a regular basis, it is impossible to eliminate this from some environments, and that's where you get lots of other, I guess I want to put deterrents in here that people will utilize to minimize the burden without resorting to drug therapy, because you can't repeatedly medicate your birds effectively to control it. We're different with the budgies in that we can, being brutally honest, you can eliminate this from your birds and never reintroduce it again. So the use of these sort of agents to stop it from a more organic, environmental friendly point of way is maybe less necessary, because I can stop it at the door, eliminate it, and I don't need to treat it again. So there isn't a persistent abuse of products here, because you can get rid of this and keep it out of your birds. So if we're looking at treatment for these two ectoparasites, and these are two, like I say, that you can eliminate, most of these are using pigeon products because they're just more commercially available. But we do need to have some common sense here. We do need to think about how we're going to treat this. We need to understand how they work, what their limitations are, and how best to apply that to control and eliminate these infections. So the first one you'll have here, and I'll put a pigeon product up here, I've also got a dog and cat product up here as well, but fipronil is a quite commonly used product, quite nice. It's a GABA agonist, paralyzes the mites. The pigeon spray one is the same as the feline canine product, to be honest, and you put a little spray under each wing, and it's quite commonly used as an ongoing thing for other species. Certainly it's used quite commonly in canaries, for example, or the pigeons, more than the budgies. We then have got the pyrethrums and pyrethrum. These basically are all from chrysanthemums. These are biodegradable, their toxicity is low, and again these cause paralysis in the mites as well. And if you use these and spray them around, this is an S-box after having used a pyrethrum spray, all the red mites have just fallen to the bottom because they've all been paralysed. And then basically this is what you've got here. This is the amount of red mite that was just in this one single nest box that had been hit by the pyrethrum and fallen down to the floor. So permethrins are also commonly used for decades, to be honest, and we know they work. We do have to be careful of concentration in these products, because a lot of the agents out there that are used for larger species have greater concentration of permethrins, and the risk of toxicity leading to neurological or nervous signs in the birds is increased. So you want to make sure, if you're going through a permethrin product, up to 0.5%. And a lot of the dog and cat ones, for example, will be around the 2%. So these can be toxic. Get the right concentration that you need for the birds. Ivermectins is another big group of drug class. These are also GABA agonists, and there's oral formulations, spot-on formulations, injectable formulations, lots of different drugs within this drug class, ivermectin being the original, I guess, standalone product, but there's lots of others subsequent to that. In birds, you do get branded formulations available at 0.1% solution, which you can get, and these basically work really nice as a topical spot-on formulation. And if you're looking at when do I treat these, when should I do this, and basically I would treat every new bird that before it comes into your birds. We want to get any bird coming back from shows, I would be treating, and I will be repeating those in 2 weeks' time and keeping them in isolation to ensure you haven't introduced any red mites or scaly face back into your collection. At the UKBC, we produce a fact sheet for you on ivermectin spot on 0.1% for you, which obviously you can get and download to tell you a bit more about it and how to use it accordingly, I guess. For birdroom control for these infections, we need to be looking at some environmental control, and there's lots of cypermethrin based products as well. These can be used as washes, etc., etc. But you also can use these as a bath if you've got, if you like, wooden cages, wooden nest boxes that you want to treat. Then there's nothing to stop you kitchen cleaning those products with the detergent, get them as spotlessly clean as you can do, and then subsequently soaking them in a cypermethrin bath. Next on your list for products here is piperonal butoxide, and this is a good agent to have in your environmental control products because it enhances the potency of certain pesticides, such as your pyrethrum and pyrethroids. And basically what it does is it inhibits, if you like, the ability of the invertebrates to break down these products, and as a direct consequence, less of your agent, if you like, has a greater effect because it's hanging around for longer. They're unable to break it down and excrete it so effectively. So this allows you to reduce the risk of toxicity with your original agent because you've got this on board. And the third thing that we like to have in these sort of products is what we call an insect growth regulator. And these are commonly used in environmental flea preparations, but these basically interferes with insect growth and development. So, and obviously they can affect them at different stages here as well. But if we've got something here that will stop the growth and development of the mites, then that's also good too. And the sort of things that we're looking at here that would have that effect would be the avian insect liquidator. This is a triple product. It's got a permethrin in there for kill, piperonal butoxide to reduce the metabolism of that product, and the methoprin as an environmental growth regulator as well. So the triple combo products really are the best on the market for these. So if you're going to go through and how you're going to go about cleaning this environment, well, there's many pesticides out there, but first you need to clean it with a detergent, get it kitchen clean. Then we're going to use the pesticide on the clean surface. We want to have the correct dilution and the correct length of time, and then obviously rinse and dry all items prior to replacing them back into the shed. For me, if you've got wire cages and things, it's just so much easier to consider this as a route. These can be dunked, cleaned, and then put in a dip or a bath of whatever agent you want separately away from the birds. You obviously can rinse and dry afterwards, and you basically have done the best you can at controlling it in the, I guess, the furniture of the bird shed. Third disease on our list is trichomonas. This is a protozoal infection. It's very motile. Normally the motile stage is what we're looking at for being the way of diagnosing this in the birds. It's generally found in the oral cavity, nasal cavity, of the digestive tract really, and we get basically just rapid division of the trichomonas in that sort of environment. So when they're passed out of the host, trichomonas dies. This is not something you're going to get from the environment that easily. The signs you're going to see with this will be vomiting and regurgitation, maybe some weight loss, can be acute weight loss, and it's direct contact here, contaminated water sources, birds feeding each other, and they can carry it subclinically for up to a year with no clinical signs. So this again pushes it into that endemic scenario where they could be carrying it and showing no signs. And you can get a rapidly fatal condition within death within up to 4 days after infection, right the way through to mild disease, right the way through to being carried latency, really. You get inflammation ulceration on the mucosal surface, and it can work its way down into the esophagus, crop, and preventriculus as well. And you can get large necrotic masses that stop the bird from swallowing food, for example. And the diagnosis for this is we do a crop wash. We instill some saline into the crop of the bird, swill it around, pop this onto a microscope slide, and if there's trichomonas there, we'll see it wiggle on that slide. The good thing with trichomonas is, like I say, it's easy to kill in the environment and it doesn't last long. Bleach works fine. So washing things, heat drying, changing your drinkers will all reduce the environmental contamination of trichomonas on a routine basis, on a daily basis in the shed. This is an old paper, but this is just a point to make here, is in going back many years when people were using dimetronidazole here, this is known at the time was known as enteral, and getting central nervous system toxicity due to these agents was well recognized. And I remember back, oh gosh, 20-30 years ago now, having people just killing loads of their birds through overdosing with these agents. And the irony is they weren't overdosing, but they hadn't factored into what the birds were actually drinking. And this is where we come on to the relevance of using products for budgies at the right dose. We now have ranitazole as our next option now. It's got a wider therapeutic margin, which is great, so it's safer. You can still market it as Hark-Anchor soluble, which is what the Emtrol used to be, a similar product. But again, all of the products out there, they're aimed at pigeons. And what you need to be aware of here is the percentage of ranitazole in your product. So we know that budgies aren't pigeons. So in terms of mil of water they drink per kilo of body weight is different to pigeons, different to passerines, different to chickens. So the dose you want to use of this product for citizens is specific for citizens, and if you follow the instructions on the packet, you're going to get the wrong dose, and that may lead to ineffective treatment and resistance. Now, there are loads of different products and loads of different concentrations, and all this means really is you're just looking for something with ranitazole in it, and you're looking for maybe the greatest percentage you can, because that generally works out cheaper in terms of active ingredient. But whatever you get, you want to get a single product with a known concentration in it, and then what you probably need is to be seeking veterinary advice to ensure you're dosing this properly. Now, if we look at the doses for pigeons, then the dose for pigeons here is between 100 and 400 micrograms per litre, up to 1 gram per litre if there is resistance in the pigeons. Passerines is around the 100 milligrams per litre, and we use the same dose for budgies as well. Because there is greater wide therapeutic margin of safety here, then you can get away with this in hot weather and in breeding birds, although I wouldn't recommend doing either of those. Whereas with the Emtrol from the days of yore, really, you get toxicity very quickly in those circumstances, and that's where people were losing birds, as they were dosing the correct water dose that's recommended, but they were using it in breeding birds who were drinking more. They were using it in hot weather when the birds were drinking more, which was obviously contraindicated for that particular product. And I'd rather this was dosed out with the breeding pairs and in cooler weather to make sure that they're not risking getting toxicity from drinking too much. We also produce a little fact sheet, really, and this is just a copy of that really on here, but that's available. You have to be critical of what concentration of ranitazole you've got in the product. You must make sure you get the right dose for your birds. We don't recommend the use of polypharmacy products or pigeon products. In that sort of scenario, you need to make sure you get a single product that just contains ranitazole, and you're using it at the right concentration. Like I say, seek advice to ensure that you're doing this appropriately. We do sometimes use metronidazole. This will again be by prescription from a veterinary surgeon, where we can treat budgies individually. and this works very, very well for the acute cases where there is a risk of higher mortality. You can get therapy into them to basically avoid death, really, being honest. And our recommendations for this really is, if you've got clinical signs, then use 0.05 mils of metronidazole by crop tube, and that can be done alongside the in-water treatment if you want to do with ronidazole as well. If you're spotting individual cases, you could treat directly when out with the period when you're treating the flock. And like I say, I tend to treat all birds with ronidazole for 2 weeks upon their arrival as part of the quarantine procedure. Fourth disease we've got here that we need to be concerned about is psittacosis. This is a highly contagious bacterial disease, transmittable to people, 20% mortality if you're untreated. Birds can harbour the disease latently and shed the bacteria for all their lives. Stress can lead to it developing clinical signs, poor diet, overcrowding, sanitation, shipping them, exporting them, cold chilling, breeding, all of these things can activate latent illness. So, the control of psittacosis is, in some extent, we've got to look at how you're treating your birds as well in terms of their behavioural and environmental welfare. There are a bunch of guidance of this online for the signs of disease in people. It's in all birds basically, and they do represent a hazard to human health as well. And because they can carry it without showing signs, then there's a possibility that, being brutally honest, every budgie shed might have birds in it shedding chlamydia that at the minute are not showing signs of clinical illness, but that could be transmitted to you still. The main route of transmission here is through inhalation of airborne particles from respiratory secretions, things like that. And we do know that bird fanciers and owners of pet birds are at greater risk of getting psittacosis. And it can just be very brief exposure is enough. If you've got a virulent strain, it can be enough to cause clinical disease. And this is a sort of classical sort of sign you would expect to see where birds have got a rhinitis or a sinusitis with discharge matting over the feathers of the head. And if you're suspicious with these, what you will find with a number of these, if you're examining them, if you run your finger across the top of the nares, you'll feel the dampness there as a discharge is coming out. Even if you can't see it on the feathers, you'll feel it, if that makes sense. So we do get respiratory signs here of upper respiratory tract disease, a conjunctivitis, so a red-looking eye as well, nasal discharge, the faeces will go a green watery colour change as well, and all budgies will carry it. And certainly from a clinical setting, from a veterinary perspective here, then some people do screen for this routinely because they are that concerned about chlamydia in their birds. In terms of its life cycle, there's two forms. We've got the elementary body, which is the infectious bit. This is the body that comes out that's spread around in the feather dust and feces. And it's the reticulate body inside the bird that actually then goes through the replication process. And the incubation from exposure to clinical signs can be as little as 3 days, right the way through to several weeks, or never at all. So the birds get this when they inhale infectious dust or airborne particles which are contaminated with infectious material. And I guess the reason I've highlighted the aerosolized word here as well, if you've got dried material in the shed, that's creating an aerosol, that's creating dust that spreads it around. And that's one of the things that we do need to be controlling in our bird sheds to reduce the risk of spread of disease, generally, not just psittacosis, and we'll go into more details of that in another session. Vertical transmission of psittacosis is possible, but rare. Horizontal transmission is what we're worried about here. Certainly we can see it on the surface of eggs. In chickens, if they've got eggs that are infected, they don't hatch. But mostly this is parents infecting the chicks in the nest box, exposure to environmental contamination, things like that is the cause of this infection spreading around. And I guess this is where psittacosis is a bit more of a problem, because these elementary bodies, which is the infectious component here, they can sit for longer than a month in the environment, particularly if they're protected by organic debris. And even if your surface is clean, it will still live for over a fortnight. So environmental control for this is obviously quite important. It's very difficult to try and confirm a case of psittacosis. There's lots of arguments as to whether it's a suspected case or a proven case. And I think most of the cases that we deal with within the budgie fancy are suspected cases. We've probably got, if we're lucky, maybe we've got positive PCR testing on feces, most usually saying the birds are shedding this organism. And that's easily achievable in the budgie fancy. What we do have to be aware is this test is testing for the DNA of the chlamydia infection. And if you treat this bird with antibiotics before you take this sample, then what you might have the situation is the birds have stopped shedding it, and that would be the case if you've given them doxycycline or enrofloxacin, for example, and then you've got a false negative result. So if you're going to run a fecal PCR, you need to run it before the birds are treated. So as much as it is available commercially, you need vet advice on how best to spend your money, basically. The agents that are effective against chlamydia are very specific. The routine antibiotics don't work here. And the routine use of antibiotics in the budgies anyway obviously is discouraged, because we get resistant strains and other bacteria coming in as well. So, if you're going to start using antibiotics for chlamydia, it has to be under veterinary advice with, an absolute, yes, this is indicated in the specific circumstances. What you do have to be aware of is that some sick birds might not drink enough. So you can inject them, or we can use a product directly into the mouth. There's nothing to stop you crop tubing anything you put in the water directly into a sick bird to ensure it gets the product. We certainly would be injecting larger citizens, but I do know a few fanciers now that have reached the point where we have trained them to inject their birds because they've just had a fulminating disease problem that is proving difficult to control. Treatment length, it does vary on what the recommendations are, and depending which paper you read and reference you go to. I stick with the recommended 45-day treatment for pretty much all of the birds that I'm dealing with, and so we're just going to do the 45 days. Yeah, you might get away with 30 days, but there's some very sound logic for why 45 days is suggested as it's a minimum based on the life cycle of this, or the reproduction of this infection within the host. And again, budgies aren't pigeons. The doses on pigeon products of agents in water are ineffective and lead to resistance in budgies and other citizens. If you're dosing these products at a pigeon dose rate, you will fail to be effective. Okay, the next thing on my list of things that I hate. There are lots of products out there marketed, and again, the drug labels may be poor on these, where you get chlortetracycline, which used to be the aureomycin, again going back 30 years here, or you get oxytetracycline, which is the terramycin products. Basically, these older style terramycin, aureomycin, tetracycline products are not effective. They are not recommended for the treatment of budgies, full stop. For chlamydia, absolutely not either. So much as there might be numbers of products of these marketed out there that people will use, the answer is no, these products are not effective. Doxycycline is a product you're going to want to use for this, and you need to again check the labels of your products to make sure that you are using the right product. So doxycycline is the product of choice here. It's absorbed better, it's more got wider tissue distribution, it's less affected by calcium, and we do recommend you use the ionized water for doxycycline to avoid the calcium. And again, I'm saying deionized water here, not bottled water. I want deionized water here for that, and you need to be avoiding any other calcium sources as well. the elimination is slower. So all of this together allows you to get away with lower drug doses, improves the palatability, or maybe less frequent administration. There's a whole variety of reasons why doxycycline is superior to chlortetracycline or oxytetracycline, and that's why I'm basically saying those products should just not be in use. There's just no point. There are millions of doxycycline products out there in its own format, in isolation, right the way through to combination products and everything else. It's very confusing. It all comes down to, again, what is the active agent and what percentage is it in that product, and is there anything else in there that I don't want in that product. Pigeon doses are for treatment for chlamydia, which pigeons get of course as well, is around the 75 to 100 milligrams per litre in the drinking water. And depending on what product you buy, if it's intended for pigeons, it might just give you that dose range. And then we've got another product here. This is again a straight doxycycline product. This is maybe a little bit better. And this product here on here, when you're looking at it, and the recommendation here we are. This is what it's telling you to give. And basically, if I do the math on here, which I'm not going to, but if you run the math down through on this, the recommended dose that this product is telling you to give doxycycline in the water is about 4 times less than the dose that I know doesn't work. I mean, it's just a ridiculous dose leading to resistance and problems. And again, don't do this yourself. You need proper help and support to make sure you get the right dosing. So the question is, well, how much do you need? Well, you know what, there's some lovely papers, because chlamydia is transmittable to people. There's lots of papers out there saying, oh, hang on a minute, we need to work out what we need to give here, how much blood concentrations we need, translating that across into how much should that be in the water, so on and so forth. So there's lovely looking at papers here in cockatiels, looking at things in budgies. There's loads of research out there, and like I say, you need to not necessarily do the research yourself, but you need to trust the person you're getting the advice from, that they understand the research and are able to interpret it. And realistically, you're back on speaking to a veterinary surgeon here to ensure you're dosing appropriately. But this is a lovely one here. This is basically is quite a nice one, looking at whether doxycycline works in budgies. And there's loads of little bits on here that you can go through on this particular paper when you're looking. But basically, if we're looking at maintaining plasma concentrations of over 1 microgram per mil, which is what we decided was the minimum we needed, even with a dose rate at 400 milligrams per litre of doxycycline, we didn't achieve that in all the birds in this study. And that's a problem that we have here that we have to accept, I guess, to some extent. And this is just showing you some of the tables from this particular paper, where you've got them giving their doxycycline here, and basically what we've got here is the 400 milligrams per litre dosage rate over a fortnight, and you can see some birds, maybe half the birds are hitting the right level, and the other half of the birds are not. There is a variable uptake or a variable water intake across the birds, meaning that this may or may not be effective on that occasion. So we're very pleased about that. We're not so pleased about this group. We also produce a fact sheet to help you here, again looking at the doxycycline and how to administer it to your birds. This is only under veterinary advice, and like I say, with an appropriate diagnosis or presumptive diagnosis made. Make sure you're using products that are just containing doxycycline, and don't rely on the dosing on the product, because if you've got a pigeon product or a passerine product or anything else, it's probably going to give you the wrong dose. Get the right advice, use deionized water, get rid of any other calcium sources, and treat them accordingly for the correct length of time. Yes, we give doxycycline direct and by crop tube for really sick birds as well. There's loads of different doses utilised in different species there as well. We tend to be recommending 25 to 50 mg per kg every day for other citizen species. So some people would crop tube with diluted ranitazole in the water as they would do normally. Others might use other products. There are effervescent or dissolvable doxycycline tablets out there as well, which people may use. And the one that we sort of recommend and use as standard really for us, it is just, again, it's just a branded doxycycline tablet, but it works brilliantly. You can crush this down and you can direct dose with a more concentrated doxycycline amount if you wish in rearing food, for example, if you were going to give them supportive nutrition as well, for example. The fifth disease we're concerned about is avian tuberculosis. All tuberculosis diseases are considered zoonotic. This is another disease that you could get from your bird. Your risk is increased if you're immunocompromised, and these cause latent infections. They slowly build up in levels, generate clinical disease in elderly individuals, in all species, being honest with you. And that's why it's easily become endemic, is because it just lurks around and hides for so long. We do know that it's Mycobacterium genevents that is the problem in the budgerigars, and other zoo-held collections have a similar sort of issues with that as well. And this is more a bird-specific sort of one, I guess. It's not like it's bovine TB or anything like that at all. But we do know, like I say, this is the one in budgerigars. The most common route of infection is oral. Once they get infected with the agent, they replicate within macrophages, and they cause basically intestinal disease in the budgerigars primarily here. These then ulcerate, release more bacteria into the lumen, which is then shed in the feces, and the cycle continues. And obviously, shedding it in the feces causes contamination of the environment, and because birds eat poo, the bird picks up the TB. They can go around the body and cause granulomas in multiple organs, and basically any clinical signs in any old bird could be due to avian tuberculosis. And if we go back and we start looking historically at, I guess, exhibition budgerigars, really look and saying, okay, well, when did we find TB? And the answer honestly is there isn't any. In 1996, there was no record of avian tuberculosis being a clinical entity in the budgies submitted for analysis. That said, they weren't doing routine histological examination on these samples, so unless there was gross lesions suggestive in the birds submitted, it's a possibility there was histological evidence that was missed because I guess it just wasn't a thorough post-mortem analysis done in this circumstances. So if you've got ATB, what do you look like? Well, you're generally old. That's over 18 months. It's taken time to develop. You're not suddenly sick. You've been sick over time. If you've got ulcerated bowel lesions, you're the people spreading it, and you're probably also the sick ones. The young birds which are infected probably aren't shedding an infection until they're older, because they've got to become lesioned to spread this condition. And if you're maintaining young studs, you've no idea you've got the disease, you've never looked, you've never found out, and you are merrily spreading it around to everybody else. There are lots of tup studs that are infected. I know this from post-mortem work that I've undertaken, and it might be if you are rotating your stud around and keeping it young, you're not seeing signs of disease, because your birds aren't getting old enough to show overt clinical signs on a problematic level or number. But if you were, say, had this infection and you were selling 100, 200 birds a year to maybe 50 other people, you tend to find that the birds that are sold by the top breeders, they hang around for a long time, simply because you spent a lot of money on getting the bird, somebody else then buys it from you, somebody else buys it from them, and these birds become quite an age and still people are desperate to get offspring from them. So you very quickly get birds from these studs that are infective in other people's studs because they've achieved the age that they would never normally achieve in the original stud. That's because people are desperate to get something out of them, I guess. So they tend to lose weight and die. And they might be clinically well, they might be breeding. You can imagine how rearing stress could tip over the edge here from a bird that was holding its own when it had no babies to feed, and now all of a sudden it's got babies to feed. Its ability to absorb and assimilate nutrients is diminished. So they are thin birds that still look bright. They're thin birds that are hungry. They're thin birds that have a messy bottom with the diarrhea. This bird is positive for avian tuberculosis. This bird is positive for avian tuberculosis. You can see how it's thin. You can see how it's got diarrhea now and feces sticking around its vent. Okay, this bird died of avian tuberculosis. We've actually had in this case a major vessel rupture around the pericardium due to the invasion of TB. It's got TB in the liver as well. Liver is a good spot for these to identify if you've got TB present. This bird was in the breeding cage. Very, very large testes. It was a fit bird until it bled out and died overnight. And you do need to have histopathology here to get the answers that you want. Because gross post-mortem you may not find it. But here we have, on the liver sample here, we have got scattered small macrophages, low numbers of positive ZN organisms. So you need to check for TB, because although this bird had avian gastric yeast, great, we know that. The fact of the matter is it's the TB here that was a concern here. It was the tuberculosis is the one of concern. And you can do ZN staining of feces, but you get false negatives. We do PCRs as well, and you can do culture as well, and sometimes these are combined. It's difficult to get an absolute answer in terms of what TB you have, but the histopath is the easiest way of getting a presumptive diagnosis based on the special staining you can do. So in young birds, you won't get clinical signs. You might get it from 18 months of age onwards, but you won't see it in the babies. But the more diseased you are, the greater the risk of you shedding, the greater the risk of you contaminating the environment and infecting more individuals with heavier burdens. So don't retire old birds. Do not have them around. If they have finished their breeding lives and they have ended, they need to go, unfortunately. And don't sell or give away old birds, because all you're going to do is encourage people to hang on to them and spread more disease around their birds. And if they're old and they say, oh, do you want to give this old bird a try? No, thank you, I don't, because that bird's a risk factor to me and I don't want it. And if your birds are thin, then they may need to be removed from the collection again for the purposes of limiting the spread of avian tuberculosis. So there's an element here of control needed that, in terms of controlling where your birds are and what they do, and I recommend segregating the age groups, keeping the youngsters away from the adults. If you do have concerns about an old bird, isolate it. Foster clean eggs away, because this isn't vertically transmitted, or it can be, but it's not, again, not a major factor for this disease. Incubate the eggs, segregate them, hand rear them. If you look back at the commercial poultry sector and how they operate, ATB used to be a major problem for poultry, not anymore, because they have completely segregated all of the ages. They've completely segregated the rearing, and breeding is something separate from the adult stock, and they have obviously effectively controlled it by the way the industry works. The sixth disease on our list is avian gastric yeast. This is Macrorhabdus ornithogaster, megabacteria. It's all the same difference. That's what it is, basically. If we go again back and look at avian gastric yeast, there sort of is a fairly long history of avian gastric yeast in budgerigars, really. And we go through here, the megabacteria here, you can see the significance that we've got here. This is looking at elementary diseases here. Interesting, we've got very high on the trichomoniasis here, as we mentioned. That's a psyllids are an important factor too, but megabacteria is way up here in terms of the diseases we see as well. So these are large gram variable rods. We see them in budgies. You get proventricular ventricular disease. You can get ulceration and bleeding into the GI tract, but this is probably the most common cause of weight loss in budgies. All right, admittedly until ATB came along, but for me, I think this is more common as weight loss in youngsters. Although acute trich is on your list, ATB obviously being older birds. And they've got to be generally over 8 months of age onwards. You might see some regurgitation or vomiting, or a bird refluxing into its crop but not actually vomiting is more likely, and it's sort of like they're repeatedly trying to swallow, if that makes sense. They will be hungry, they'll get weight loss, don't tend to get diarrhea in the same sense that we get with ATB, and again it's a chronic disease that takes time to develop. This is a bird, and again, classical sort of appearance. The arrow here is pointing to the isthmus between the proventriculus and the gizzard of this bird, and this is where we're sampling to look for the avian gastric yeast. So smear from here, basically that's a section that I want. That's going to tell me if you've got any signs of Macrorhabdus in that area. Get it on a slide, have a look, and like I said, they have gram variable rods that we will be finding. Just a few more pictures here again, and once you've got used to seeing them from a cytological point of view, from a post-mortem point of view, then obviously very easy to identify. There are a variety of treatments out there that can clear out this organism, and we get a lot of cases that will come through on post-mortem that are negative, where you would also probably want histopath to say, okay, is there damage in this proventriculus that's consistent with having had this infection present? And this is sort of megabacteria associated disease, or MAD. But you do want to sort of have the histopath alongside the cytology here to confirm that this is being pathogenic in that individual. And you might eliminate the organism with some of the treatments that are there, that's great. But if I've got maldigestion as a consequence, I'm too sick to save. And once you spot me being sick with avian gastric yeast, I probably am too sick to save. You need to be controlling this infection before that happens. And again, get your histopath. We want the histopath here. That will help us determine what's going on. We're looking at changing the proventriculus and ventriculus to confirm what's happening here. So our treatment options for avian gastric yeast are variable really. It is a fungal infection. Amphotericin B is the antifungal, I guess, antimicrobial agent that we recommend. It used to be used for thrush in people many moons ago, and it's not so widely available now. In the UK we have a lozenge for human use, but it's been practical. There's an IV preparation, but that's nephrotoxic and really isn't any use either. You used to be able to get a product manufactured in Australia called Megabac S for it, which is one, and there is another product on the market now available too for in water treatment, but again quite difficult to get and quite expensive to get, and this really is a bit more historic. We're not using the amphotericin so much these days. But if you go through and start looking at some of the papers, there's loads of descriptions on this. This was quite a topical thing a number of years ago, looking at it and treating them with amphotericin to confirm it works from this is 1997, so you can get an idea of how old this disease is. It is effective, but you've got to get them to have enough into them. They need to have it crop tube twice a day alongside rigorous hygiene to control it. And if you're putting it in the water, then basically again you're probably going to wind up with an inadequate dosage, and I'm not sure this is the best way to be trying to control avian gastric yeast, being honest with you. We do know, of course, that sodium benzoate works. There's lots of fungistatic food additives out there primarily that we do know is effective, and this is one such paper looking 2014 now, jumping forward here, looking at sodium benzoate as an effective treatment. And there's loads of others on the market out there that claim the same effectiveness. There's no real science to back it up. So again, lots of products out there being marketed for this that have variable to no science behind the back of them at all. For me, I have something that says sodium benzoate is effective at the 1 gram per litre per month. be aware of neurological signs, but we know this works. The other ones, no, that's up to you if you want to have a little guess and see what happens. It's fungistatic. It's a food additive. You can buy it very easily from online companies without any problem at all. The other thing you've got here as well, which again you could do, is this isn't vertically transmitted. If you want to eliminate this, then if you get your birds to lay the eggs, take the eggs away, hand rear them, you can eliminate megabacteria completely. You'd also probably eliminate avian tuberculosis, and you'd probably get rid of trichomonas, and you'd probably get rid of a whole variety of diseases. But then you've got the risk of re-exposing your birds to them every time you show them, mix them, get a new bird in. But we can control these diseases if you wanted to. It's all a question of the population management of your birds. Seventh disease on our list is polyomavirus. And this is sort of a classical sort of French molt scenario here that we've got, where you've got birds with lack of feather production and changes really. Going back historically into the 1960s, this was believed to be nutritional based, although there was no evidence really there because it was just circumstantial. And the fact of the matter is it's not nutritionally based. But some of the observations made that led to that conclusion, nevertheless, a common sense, if that makes sense, in that we know, if you read on the bottom yellow box here, you know, if you want it to appear experimentally, it's round 3 or round 4 where you're starting to see signs of it normally, when the birds are running out of baseline nutritional support. They're getting more stressed, the feather dust is increasing. So maintaining good nutrition does help reduce its exposure, as does reducing breeding stress on the birds as well. But that's not the cause, that's just factors involved. Again, this all boils down to keeping your birds at the best husbandry and welfare to minimise disease problems. If we move forward to 1995 now, so we've jumped 30 years now, quite interestingly enough, Budrigar fledgling disease was the first generalised infection that was attributed to polyomavirus. And it was first reported in the USA in 1976, causing acute death in young budgerigars. In the EU, in Europe, we get a more chronic form, whereas in the USA a more acute form was thought of at the time. But both of these presentations are now recognised worldwide. There isn't really a difference between whichever country you're in, it's the same. But this is a sort of situation you get some lovely, healthy budgerigars growing along, of which you're happy with. Oh, this is great, and you think, what's going on with this little one? Why aren't you growing? Why are you dragging behind all your friends? And this is a polyoma bird. We do get neurological signs with this condition. I've seen 3 cases of late, which is unusual. We don't really see that often, but you do get it. It is a systemic infection. And we also will see peracute bone marrow suppression and anemia in individuals, and this can happen within hours. You'll have a bird that will be fine 1 minute and literally go anemic and die within 6 to 12 hours. You really can see quite an acute change on that. But I guess one of the more classical presentations that we see would be birds that would be progressively losing feathers in a variety of formats and contexts when they're weaning, fledgling, or even up to 6 to 8 weeks after weaning. You'll see this. And again, another sort of classical scenario here where you've got a bird here that literally has just lost all of its feathers. This bird has just recently fledged, and again, this is a classical polyomavirus appearance. So the mortality rates you get with this do vary depending on the age of exposure. It progressively increases in the severity over coming months as the flock continues to breed. You can get pretty much all of your chicks infected, sometimes up to 90% affected as well. And again, you might have severe feather abnormalities and nothing else on gross post-mortem that suggests disease. There's lots of papers looking at how polyomavirus in budgies is maybe handled differently to other citizen species. And again, on post-mortem, we do see, you may see everything is perfectly normal on here. It might be difficult to identify on a gross post-mortem. Go for your histopath. Go for your kidneys. It's a lovely place to spot inclusion bodies consistent with avian polyomavirus in kidney histopathology. So even though you might not find it in the bird, if you've got inclusion bodies in the kidney, that's giving you a serious nod that this bird is clinically affected with polyomavirus. So get histopathology, confirm the inclusion bodies, don't be relying on other tests. What is interesting when you're looking at diagnosis of polyomavirus, this is just one of the reports that I've sort of had come through from obviously people I've been dealing with, and here we've got negative polyomavirus. Great, it's no polyomavirus, but this is positive in the inclusion bodies on the histopathology, which is interesting. And again, if we start looking into that a little bit further, well, here we are showing here that some of the commercial PCRs out there aren't as effective as some of the more I guess more recent PCRs that have been developed available for that. And if we just look at the little yellow box here as well, we've got 28 out of 56 positive samples using this PCR, but only 19 positive in a traditional PCR as well. So you are going to get false negatives on your PCRs. It depends on sensitivity, etc., etc. So we just have to be aware that you may miss these things. So there is your explanation as to why it was negative. And again, back onto post-mortem here, a different post-mortem here as well. We've got hepatic polyomavirus here. This bird has polyomavirus. The fact it was negative on PCR is irrelevant. Okay, the 8th disease we are concerned about here is citizen beak and feather disease. This actually is more of a clinical problem in larger species. It's an immunosuppressive circovirus transmitted by feather dust all over the place. Again, you've got commercial PCR tests available, but vertical transmission is also relevant for citizen beak and feather disease. And there's loads of papers. PBFD is a massive thing again. Lots of papers looking at the detection of it in embryonated citizen birds here as well. On this particular paper here, and we're seeing that you've got 35% of non-embryonated eggs have PBFD DNA in them, 20% here of embryonated eggs have DNA in there as well. You could argue that maybe there's a difference there because some of the non-embryonated embryos, if you like, die before you can tell they're embryonated, which obviously may account for decreased fertility and hatchability in some of these species too. But it's an endemic disease, and if you're positive, it could be mild, could be transient. We do want to distinguish between PBFD and polyoma, because if the vertical transmission is such an important factor, and polyoma is more horizontal transmission, how we're going to try and deal with these is going to be variable. Although there's nothing really clinically that hand on heart you can say is one or the other when you're looking at budgerigars. And of course, you've got lots of papers out there. This is another paper here going, oh, we've got a novel beak and feather disease in budgerigars. Oh, brilliant. Okay, you found beak and feather disease in budgerigars. But they were clinically suspicious. They had birds showing signs of French molt, if you like, or budgerigar fledgling disease, and went, oh, we found beak and feather disease virus. There's no histopathology here. There's nothing that says we have got inclusion bodies of beak and feather disease virus in these birds showing evidence of a host pathogenic response. There was no screening performed for polyomavirus to say, oh yes, we screened and there's no polyomavirus. And we don't have any kidney histopathology saying, oh no, there's no polyoma inclusions in here at all. Yeah, they found a beak and feather disease virus in the budgerigars, but whether this is clinically relevant or linked to the clinical disease which they are claiming is unknown. So if you want to control diseases in your birds, the bacterial and viral diseases now we're on to now really, we've got to reduce environmental contamination. We need to use disinfectants on clean surfaces that are shown and proven to be safe and effective against diseases. We're not interested in marketing or selling points, proof. And there's obviously lots of them on DEFRA website which will show you activities, and that's a reliable source to go through when you're looking for disinfection. Or go on to research and look at the right product, right concentration, the right contact time. Speak to a veterinary surgeon. Get the advice that you need to ensure you're doing if you're going to spend your time doing this, let's make sure you're being effective. You've got to clean up the shed, okay? And depending on the nature and style of your shed and environment is going to impact on how easy it is to clean and hygiene. That comes back to, again, seeking advice on what is the easiest way to clean up your shed. How can you control things best? And depends completely on design and setup, on how hard or easy you have made that job. First, clean, then you disinfect afterwards. Get your detergents to remove all organic material, and if you've got big issues, then discard everything you can do to start afresh. You want to use a diluted solution when you come to disinfecting that is effective against polyoma, for example. And if you've got wire cages, for example, and wire aviary set up, then life is so much easier, because I can dismantle all of this, I can treat all this, I can scrub it spotlessly clean, I can soak it in a bath of disinfectant that's not contaminated with organic material at the right concentration, at the right length of time. My ability to control infection in wire cages and wire aviaries is so much easier than wooden. So get everything spotlessly clean first. Rule number 1, clean them up. Get the cages out. In this, obviously, here we're looking at polyoma virus inactivation here, saying, right, I want to have a disinfectant that I know is going to eliminate this infection now. And this is, I can appreciate this is porcine circovirus, but it's the same thing here. I'm looking at a disinfectant that will eliminate porcine circovirus because I'm worried about PBFD too, so that's great. So let's get a product that we know we can rely on. And like I say, if you go into the DEFRA site, you're going to get a list of disinfectants that are approved for eliminating certain diseases and conditions. You can export this list if you want to as well, and you'll see if we go down here looking at sort of the different orders you've got here. And if you want to control avian TB, you need a disinfectant that DEFRA has approved for the tuberculosis orders here, sort of, so column 4 in here, you want something that's in that column too. F10 isn't on the list for TB control, I'll just say that now. Vercon is not on the list for TB control. Some iodophores are for TB control, but the dilution rate is 50 mils per litre of water, so it does depend on product which iodophore will be effective against avian TB. Good thing this bleach actually works. Polyoma is very sensitive to it, PBFD a bit less so, ATB does take quite a lot of effort to get rid of TB on surfaces. But realistically, what we're looking for is 1 ml of bleach to 3 ml of water for 10 minutes to eliminate tuberculosis. That's uber concentrated. That's quite an expensive way of doing it, and you certainly wouldn't want your birds or to be inhaling the exposure to anything coming off from that. So if you can set up a bath with this in, you clean everything spotless and you just rotate everything through that bath for 10 minutes. You can eliminate TB from the environment. You've just got to rinse these off afterwards before you put them back in the shed afterwards. So being able to empty things out, decontaminate it, disinfect it, rinse it and replace it is the best way for environmental control for you. But you do want to use the right product, the right concentration, at the right contact time without organic contamination. And again, just pop them into a bath, let it soak through, and you're doing the job that you would hopefully want to do. Again, smaller items, smaller tubs, works perfectly fine. There are some management changes we need to put in place here for polyomavirus, and we know, if we're looking at this from a specific point of view, we know this is fledglings and nestlings that are shedding this, that allow the infection cycle to continue. And this is where this sort of stop breeding comes in, is because you're trying to reduce that shedding of polyomavirus due to stress of rearing. We do see it in continuing in adults of breeding age, and we also do see it in adults that are older than that as well, but it's the babies that we're mostly concerned here. Your key sort of points for the management changes here, and this is again a paper back from 1995 again, but they were able to successfully eliminate avian polyomavirus. They'd rested the birds, so there's less shedding in the adult birds, and they then bred them for 2 years continuously. And the adults they started off with were all positive, but because they'd rested them, then they continued to breed them after they had been completely rested. They were able to produce seronegative offspring from what was originally an infected group. And so this is great. This says that, okay, if the nestlings and fledglings are the main shedders that we're concerned about, then we've got to stop breeding for 6 months to aid in reducing elimination or severity of disease in subsequent generations. And like I say, we do see it continuing in the older birds as well. So trying to reduce the horizontal transmission of disease, then we've got to look at nest box hygiene, your hen hygiene, your hygiene. Is big and feather disease or polyomavirus the one that's of concern between us? If I move the chicks between these nests, am I just going to cross-infect the next nest? They don't have social distancing, shielding, or any idea about hygiene, so we've got to do that for them. And if your birds are recovered, are they still going to shed it? Will they shed it when they go back to nest for the first time, when they're stressed, and perhaps reactivate it? So what I will say is if horizontal transmission for PBF, if horizontal transmission is important for polyoma, then we'll probably get away with cock birds. We can probably use the hens, but I don't want you rearing. I don't want any risk of you contaminating those eggs with horizontally, or the chicks with polyomavirus. I might take these eggs away and put them in another nest. I might incubate them. So it all depends, again, down onto how you're going to manage the birds in terms of which is the most, I guess, beneficial route for trying to limit or avoid these infections causing you issues. I hope this presentation has started to get you thinking about the health and welfare of your budgerigars, what diseases we've got to control, etc., etc. And the UK Budgerigar Club, of course, we are committed to ensuring you're getting fact-based health and well-being information for your budgies. This is just really an introduction for you, because we have lots more available to our members for I guess making sure you get the right products at the right concentration that you need, and the right way of implementing health controls in your budgerigars. So please join us, and there's so much more we can help you with for your budgies. And thank you for listening.